my name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I am joined by Kate Merchant. She's NMC's Family Birth Center Nurse Manager. And we're going to get to know her a little bit better today as we learn about her and her new role. So Kate, thank you for joining us today.
Thank you for having me.
So it's wonderful. I've seen you grow at Northwestern Medical Center. So maybe just introduce yourself and what you're doing, and maybe a little bit about your background.
Okay. So I've been at Northwestern Medical Center for a little over 3 years now. I started off as one of the 2 quality specialist nurses at the organization, and have enjoyed my time here, and was looking to get back into some of the clinical practice areas, and so thought the Family Birth Center would be a good place for me.
That's wonderful. And how long have you been a nurse?
I've been a nurse, about 13 years now.
Fantastic.
Yeah.
Now, 3 years at NMC, and what were some of your experiences prior to NMC that maybe led you to this position?
I previously worked at University of Vermont Medical Center. I spent about 10 years on their mother-baby unit, which is high-risk antepartum, postpartum, and the newborn nursery. I worked on the night shift as a staff nurse, and I was also their assistant manager for a few years.
Fantastic. So you got great experience.
Yes, absolutely.
Came to us as in quality,
Yes.
and then now this has opened up, so it's perfect for you.
Yeah.
Fantastic. So tell us a little bit about the role. What is it like to be a nurse manager on the Family Birthing Center? What have you learned? You've just started, right?
I just started. I started July 1st.
Okay.
So I'm 2 months in, and I have actually learned a lot about the patient population and about the staff. One of the things that has been most apparent to me is the team that we have in the nurses. And I had a chance to meet with every one of them over the last 2 months, and I asked each of them, what do you think is working really well for our unit, and what's that one thing, and every single one of them answered the team that they had. And you can really see it in the way that they interact with each other and the things that they are accomplishing for our patients and as a team on a daily basis. So that's been one of the best things that I've seen. The other thing that is really apparent to me is the partnerships that we have with our community and with our patients, and how we are learning to maximize those and improve them, so that we can wrap around and give the best patient experience. And when I'm speaking about the partnerships, I'm talking about home health and our colleagues in the OB clinic and our colleagues in pediatrics, Department of Child and Family Services. There are already established relationships with all of those, and we are working to improve them. So it's been really nice to see.
So it's not just about the unit.
It's not just about the unit.
It's really connecting about relationships internally and across the community.
Yeah, we're pretty lucky as a unit because we are the ones that are delivering the baby, and we're there for some of the most intimate pieces of a person's life. But really, we have to also think about what we're doing to support the success of the patient and the family, and that experience starts in the OB clinic, and it continues after the patients leave the Family Birth Center. So it's really important to maximize the partnerships that we have with all of those groups.
Wow.
Yeah.
Very interesting.
Yeah.
You just think about, she's a nurse manager of the Family Birthing Center, so it's there, but you can't do that without a greater team.
That's right. That's right.
So the staff that you have on the unit, so are they younger? What's your mix of staff? How would you describe?
We have a very good mix. We have some more seasoned nurses. I think the one that's been there the longest has been working for about 35 years. And then we have someone that started last year. So there's a pretty wide mix, and it actually is very beneficial when you're talking about improving patient care, because you have some people that can precept and mentor, and you have others that are bringing new ideas and new evidence-based practice to their work as well. So it works out.
So there's good mentoring and helping each other grow and learn in their practice.
That's right.
That's fantastic. Yeah. So what is your assessment? You've got a great team. Any other assessment that you've made? And if we were sitting here a year from now, are there things that you want to accomplish, or have you had a chance to even size up what the possibilities might be? I'd
probably want to accomplish more improvement and collaboration with our colleagues, both inpatient and outpatient. We have a lot of focus on education for the staff coming up. We are looking to increase our volumes, and we want to, just improve the overall experience of the patients. I can confidently say the experience that we're giving is wonderful. And we have received feedback from many patients, especially recently, on how well their experience was on the unit. And so we just want to continue to move that forward.
Wow. Yeah. So what does education look like? What do nurses need to know on the unit, and what do you hope to advance in their learning?
Sure. We have a mixed patient population. So we deliver babies. They need to know the labor and delivery piece of it. We also need to know maternal, like postpartum, and also newborn care. And we also have some inpatient pediatric volume of patients that we see. So there's some education for them as well. When we're talking about foundationally, just basics of all of those different types of care. And then we're really going to focus on some emergency type situations because some of those things, higher risk things do happen. And so we're going to be spending some time running through some of those scenarios as well.
So being prepared for things that are probably low volume, but when they happen, you want your nurses ready.
That's right.
And you want the family to feel confident that they understand and can help them through that experience as well.
Yeah.
That's terrific. Now, baby friendly, what does that mean, and is that happening? I know we talked about that a few years ago, but is that experience still happening?
Absolutely. So baby friendly is a designation that's received for hospitals and organizations that focus on promotion of breastfeeding and improving breastfeeding outcomes in order to improve population health outcomes and overall health. And so, yes, we are still working towards our baby friendly. We received the designation about 3 years ago, I believe, and we'll have to recertify in a couple of years.
Okay.
We have lactation support on the unit, and we are working with our health partners from home health, and also working with the OB clinics and the pediatric offices to start bringing some more of that lactation support to the outpatient clinics as well. So it's not just on the unit, it's an organizational thing that we're working toward. And so there's more to come on that.
Super. I'm glad that's still happening and going strong.
Yeah.
So, it wasn't too long ago, and it's well in our memories, that the nurses really spoke up and they wanted to have a voice, in their practice. How is that happening with you and your unit? You're probably setting a new pace for that. So how are nurses involved in deciding about their practice?
Right. I think that's multifold. So on our unit, we've opened lines of communication. I have a unit that I feel we communicate very well with each other. We are moving towards, as an organization and at the unit level, clinical practice governance, which is a model for nurses to have a say in their evidence-based practice and improving outcomes by process improvement. So there's a lot of work going into that, and many opportunities for nurses to have a voice in their practice.
That's wonderful. Yeah. I think it's so important because they'll be so invested and engaged if they feel purposeful.
That's right.
And valued. So thank you for that.
My pleasure.
That's awesome.
Yeah.
So tell me about you and your family.
Yes.
So I bet folks would love to know who you are, a little bit about your family if you want to share.
Sure. I live in Winooski with my husband, and we have 4 boys. They're ages,
4 boys?
4 boys, yes. We're quite busy. Ages 12, 10, 6, and 2.
Oh, boy.
We're pretty involved. They're very involved in sports and different school programs, and so we stay pretty busy.
It sounds like it. I was going to ask you what you do for fun, but I think you've told me.
It, yeah. You can usually find me on a field, or we spend a lot of time outdoors. We have a boat, so during the summer we like to go fishing and just be out on the water.
Well, that's perfect for boys, right?
Yes, absolutely. Yeah.
That's great.
Yeah.
So when you think about, nursing, what do you hope for nursing at Northwestern Medical Center? And you've taken on this leadership role. Mm-hmm. You've stepped up. Obviously, you're passionate about it. Mm-hmm. So, what do you hope for nursing?
I think, just really to improve our clinical practice and provide the care that our patients and our community know that we are giving. I had some opportunity this weekend to spend some time on my unit and
Nice.
care for patients, and there were multiple that told me how wonderful the nursing care was at Northwestern Medical Center. Yeah. And it was just, it makes you take a deep breath and take a pause and say, this is why we became nurses, and this is why we're practicing, and this is why we chose Northwestern Medical Center. Mm-hmm. It really is a special community. So I would hope that, moving forward in the future, nursing at Northwestern is recognized and continues to be recognized at that level. I think it's really appreciated by our community.
Yeah, there's nothing like your small community hospital, right?
Yeah.
That you can wrap around so the experience is personal.
That's right.
It's you get that firsthand attention and experience and that assistance that you need in your experience, and you can design it, right? Patients
right.
have a say.
That's right.
In what they want for their care and how they want their birthing plan to
That's
go.
Right. Yeah.
So, you had mentioned earlier that you hope to increase the births. I know the birth rate is down. Mm-hmm. However, we have Dr. Disney here, Dr. Liz
wonderful.
Disney.
Absolutely wonderful.
We love the guys, Dr. Sullivan and Dr. Trombley. Dr. Disney brings that female component back into the picture if someone should want to have a female
That's right.
In their experience.
Yeah.
So it's great that we have a new team, and she probably brings some fresh ideas as well. I'm sure you probably have seen her around, so it's wonderful to have her here.
Yeah, she's been wonderful. I've heard great feedback from the staff so far.
Good.
I think she's only been here about a week and a half, so yes, but I'm very excited to have her as part of the team, and I know the rest of the staff is as well.
That's terrific. Yeah, that's great. So is there anything else as our time comes to a close that we should tell our community about for the Family Birthing Center, having a baby, or women?
Right.
Anything that you would like to share?
I think I would probably just reiterate how wonderful the staff and the care that we provide is, and I would welcome any feedback from the community. If there's anything that they feel like we're missing or that we can improve upon, I would love to receive a phone call or an email or set up a meeting with anyone so that we can take that feedback and see if there's anything that we can do to improve our care.
That's terrific. So you want to be very open with the community. And if someone wanted to have a tour, if they're trying to figure out where they're going to have their baby, do they call the unit?
They can call the unit and we can set up a tour for them.
Great.
Yeah.
That would be wonderful, because once you get on the unit and you meet folks, it's so personal.
Yes, it is. Yeah.
So we would love to have folks getting their care here locally and know that we provide all levels of care necessary, and we have a great partnership with UVM Medical Center should we need.
That's right.
Right?
That's right.
So that's fantastic. Okay, thank you. Thank you for being our nurse manager of Family Birthing Center. I can't wait to see where we're at a year from now.
Well, thank you for the opportunity.
I appreciate your passion. So
Thank you.
for nursing, right?
Yes.
Nurses. We're nurses.
We're nurses.
That's right. We're nurses. Thank you. Well, thank you for joining us today. I'm Jill Bowen, CEO of Northwestern Medical Center, and your host today. And it's been wonderful to learn about Kate Merchant, our new nurse manager of the Family Birthing Center. So give her a call. It sounds like she's very open and would love to talk to you about having a baby at Northwestern Medical Center. Thank you.